Dear students, in this video I want to focus on asphyxial deaths. Asphyxial deaths are so many. Among these, hanging is the common, then uh, accidental asphyxial deaths by positional asphyxia or traumatic asphyxia, stampede are common. Homicidal strangulations, accidental strangulations, even suicidal strangulations also possible. Garroting, rare. Mugging, banzadola, these are all rare. And now lynching is not so common. It's olden days in America. Condemned persons are uh, hanged by the mob. Uh, Homicidal hanging by the group of people on a condemned criminal is lynching. Burking is a combination of smothering and traumatic asphyxia. Person sitting on the chest of the victim and closing his mouth and nostrils. This is burking. Among these asphyxial deaths, hanging is the common. Now I want to focus on how to write antemortem external wounds in case of hanging. Already it is narrated in previous video. Ligature mark can be described as an abrasion mark. Abrasion mark is brown in color. Parchment-like appearance at the base. Parchment means hardening, just like paper, cardboard-like. Antemortem abrasion will become more darker after death and parchmentization is seen at the base. Any pattern of the ligature material can be seen at the base of the ligature material. So the abrasion mark can be described as 2 centimeters or take it 3 centimeters. In case of soft material, it may be more wider. Total length of the abrasion mark can be measured around the neck. For example, 30 centimeters or 28 centimeters, like that. A 28 centimeters long, 2 to 3 centimeters wide, brown colored abrasion mark seen over the around the neck, obliquely placed with a gap of 8 centimeters below left ear or below below occipital protuberance. Like that you can describe. This is about hanging. Already this is described. You have to mention about what is the distance between ligature mark and symphysis menti, angle of the mandibles and occipital protuberance. Next, coming to the strangulation. Strangulations sometimes may be one loop or 2-3 loops may be around the neck. The ligature material may be in situ at the time of postmortem examination, or it can be removed by the police or treating doctors. So a ligature material can be brought separately. If ligature material is brought along with the body, then we should not cut at knot. Knot should be preserved, either in case of hanging or strangulation. We have to describe it is horizontal nature or oblique nature of the ligature mark. Then strangulation, even suicidal strangulation may be possible. How? Because if the ligature material is made a knot, 2-3 knots with tight fixation, may cause patient unconscious. Once the patient become unconscious, the victim cannot remove himself the knots. So it will cause suicidal strangulation also possible. Accidental strangulations by chunni or upper cloth or mm, some other material which is used for the ornamental purpose around the neck can be tangled or caught, cause strangulation either during work or during travel. These are about strangulation. Coming to the smothering. Smothering is the closure of external orifices of the mouth and nostrils at a time by their hands or by soft material. In such case, there may not be any external wounds over the mouth or nose, but because of pressure effect, inner surface of the lips can show some contusion marks due to teeth imprints. So this is about smothering. Then gouging. There may not be any external wounds, but the victim may struggle in homicidal cases. Such struggle marks, injuries can be seen. Otherwise, if it is an accidental gouging or choking, there may not be any external injuries over the face or head or body. Next, choking. Choking, unless otherwise is proved, is purely accidental in nature. Even a small food particle can cause choking. Unfortunately, the larynx will overact, preventing any foreign material to enter into the trachea. The larynx and vocal cords will go into spasm and capturing the foreign material so that it will produce laryngeal spasm. Nothing but spasm of the vocal cords. By that means, a sustained spasm for a considerable period of 3 minutes or more than 3 minutes will cause asphyxial deaths in choking. Sometimes, even after death, the vocal cords may not be relaxed. In such a case, we can see the classical picture of choking, that is laryngeal spasm or spasm of the vocal cords. Next, coming to the traumatic asphyxia. Traumatic asphyxia is trauma or pressure, continuous pressure over the chest. A basic mechanism of respiration, if you understand, the sternum and ribs will move upwards and forwards. So we need some space for normal respiration. If there is no space for the movement of the rib cage or sternum has to move upwards and forwards. At least few centimeters we need. If there is no space, if there is a continuous compression or overload or weight or manual pressure or mechanical pressure or stampede, which preventing normal respiratory movements will cause stampede. Traumatic asphyxia. If there is a sustained pressure over the chest, for example, this level of compression, above the level of compression is congested, below the level of compression is pale. Line of demarcation can be seen. In one case I have seen, in Tirumala it what happened. I attended for the court after reporting the post-mortem examination report. Young driver is parked the lorry, that is marble stones, slices of marble stones vertically placed in the body of the lorry. The laborers are attempting to download the marble stones, which are slices, from the lorry. Unfortunately, accidentally, because of loose soil where the lorry is parked, at the time of unloading, the lorry has tilted to one side. By that means, the laborer, only a single laborer was there, which is helping to download the marble stones. All the marble slices are fallen on his chest. Before rescuing, he succumbed because of traumatic asphyxia. In such case, there is line of demarcation. Below line of compression is pale, above line of compression is congested. Because of lack of respiratory movements for more than 3 minutes, he died. Because of immediate resuscitation or rescue methods, he succumbed. This is about traumatic asphyxia. The same thing happening in stampede. In stampede, children and female or older age people are vulnerable because of continuous pressure over the chest by the multiple persons is happening in stampede or landslide or any house collapse. In mass disasters, these are the cause of death. We have to mention about what is the triad of asphyxia, that is cyanosis, congestion and petechial hemorrhages. Either external features or internal features we have to mention clearly in post-mortem examination report. We should not forget about line of demarcation. That is about traumatic asphyxia. Next, garroting. Garroting, lever will be fixed a ligature material so that a special mechanism will be seen. Even suicidal garroting is also possible. Is actually maybe homicidal. Next, these are all things of asphyxial deaths. Among these, hanging is very, very important. In prolonged hanging, the neck will become elongated. The body shows decomposition. Hypostasis seen in lower part of the limbs. Upper limbs and lower limbs are showing hypostasis rather than back of the body. Based on these findings in asphyxial deaths, on internal findings, all the organs, viscera are congested in cut section. This point we can highlight. Thank you very much, my dear students. You make at least one or two scenarios of asphyxial deaths. Cause of death in case of hanging or strangulation. Deceased died as a result of asphyxia, as a result of pressure over neck, due to suicidal hanging or homicidal hanging. Even homicidal hanging also possible in case of weaker sex or pediatric age or older people, when the person is intoxicated by other means, or some other times multiple assailants may cause the victim homicidal hanging. Thank you my dear students. Continue.